we tend to forget that the world around us shapes everything about us. At a very core physical level, the air we breathe, the water we drink, the food we eat, obviously affect us and affect what we do and our health, but the spaces around us, the physical environment around us, the people we interact with, shape who we are and what we do. And I think that's true of me as well. My formative experiences in medical school and after medical school were in remote rural areas where I was working, essentially bringing medicine to places where there was no medicine. And that really informed how I think. I was committed when I finished medical school to being a doctor in areas that needed me. And I think I developed a fairly strong sense of wanting to understand health and understand how health is generated through my experiences in those areas. In some respects, I see it as a bit of a straight line from working in Somalia to what I do today. My health today at my age is a function of how healthy I was 10 years ago and choices I made 10 years ago. And the choices I made 10 years ago were a product of the choices I made 10 years before that, and then 20 years before that, the choices that were made for me by my parents. Yes, smoking, our understanding that smoking is harmful to our health really dates back to about the 1940s with studies in the UK, which are initially where these data come from, that was among physicians originally, that started showing that smoking is associated with poor health. Ultimately, those data became the Surgeon General's report in the 1960s that illustrated that smoking is associated with health, which then led to this wave of public information and efforts to stem what was then an increasing tide of smoking in this country. It's data, it's at the heart of informing what we should be doing to generate health. Now, I've argued that data should be data informed by passion and purpose, and that purpose is to improve the health of the public. But fundamentally, without data at the core of what we do, we will not have the foundations on which to build the path towards better health. Well, I think the biggest change in data is the volume of data available and the speed with which it's available. I think now there are data sources that can characterize many more aspects of our life than there used to be, and that those data are available in a much closer temporal present than they used to be. When I was growing up in the academic world, I was accustomed to data being available 1 to 2 years later. Now I think our metabolism and our appetite for data has shifted quite a bit, and we get impatient if data are not available soon after the data are collected, and that's how it should be. Larger data being more readily available. So I think this creates tremendous opportunities. Data are only as good as the questions we ask, they're only as good as the lens we take on them, and they're only as good as us being able to extract meaning from those data. So in some respects, having so much more data available and so much more data available quickly poses a real challenge, because it can be a tsunami of data, and there are enormous data sets that are publicly available. So I think the next step challenge is how to take those data and to generate meaning from them. I think we're going to be able to capture people's state of being, state of living, the context in which they live throughout their whole life. We're going to be able to have data that essentially creates a history of our existence, which can give us tremendous insight into what generates a person's health. And I'm hoping that we'll also have data that shows the nested context within which we live, the data that is able to connect us to our networks, to our cities in which we live, to our countries and those policies. If we can create data that is longitudinal, which is over our life, starting from neonatal period to childhood, all the way to adulthood, all the way to older adulthood, and we can have data that is nested, that shows me within my immediate context, linked to my network, linked to my city in which I'm in, and understanding the forces that are both within networks, within levels, and also over time. I think that can give us a much richer understanding of what generates health for any individual throughout her life course. I think data by themselves are noise. Data by themselves are zeros and ones and clouds of zeros and ones that do not tell us very much. The wisdom is going to come in extracting the signal from all that noise And the more data we have, the harder it is going to become to create clear understanding of what the story we're trying to tell from the data. So any way in which we can both analytically, statistically, come up with the sharpest story we can and then convey that story as sharply as we can. I think data visualization plays a real role in that. I think there's going to be a greater need and greater importance of smarter data visualization approaches to extract meaning from data that can then become wisdom. And I always worry that those of us who are in the quantitative population health science business get very enamored by fancy statistical models that come up with really cool and statistical solutions that are difficult to translate into a story that is told that can generate change. And I think data visualization is a core part of telling the story that can generate change. Well, I'm always thinking about things to write, so I'm not sure I have a next. But to tie in a series, I did a book called Healthier, which was really 50 thoughts on population health, which was intended for an academic audience. And then that was followed by Well, which is the book that just came out that you referenced, which is called What We Need to Talk About When We Talk About Health, and intended to translate the message about some of the core aspects of health that I think are misunderstood, but to a general audience. And I'm thinking of doing a third book to sort of end a bit of a trilogy on that, that specifically is called something about uncomfortable conversations about health, that talks about some conversations about things like incarceration and poverty that we are not very comfortable thinking about as being inextricably interlinked with health. And then I'll think about other things.